SLQS members. Today we have a special session, unlikely our usual CPDs, considering the timely requirement. We have a special doctors panel, Sri Lankan doctors panel, to explain about the COVID-19, how to prevent and overview of update. So they are going to do a very valuable session for our members. Today the doctors panel, we have 6 doctors, Sri Lankan doctors, currently working in Oman. Dr. T. Firaz, Dr. Anesta, Dr. Nusra Begum, Dr. Dinesh Barnasuriya, Dr. Imthiyas, and Dr. Riyaz Mohammed. We have for SLQS committee in Oman. I welcome you all, and it will be we welcome all of you. We have of the SLQS committee, and today we are going to broadcast this through YouTube also for other quantity surveys in the world who can see this. So I kindly invite you to start the session. Please go ahead, please.
Okay. Give me a second.
Yeah.
Can you see the slides?
Not yet, doctor.
No?
Yes. Yes. It's started.
You can, huh?
Yeah.
Okay. Okay. Good evening, all. Before starting, I would like to express my gratitude to Sri Lankan Community Social Club and the team of doctors. The compassion you show to the people we serve is an inspiration for us all. We are only few who will be presenting today out of a team of 34 dedicated Sri Lankan doctors. And thank you all for the generously donating your time and talent in the fight against Corona. Saying that, I would like to welcome all to this webinar. Okay, all this started a couple of weeks back when Mr. Roy requested us to do a presentation regarding Corona, but with a condition. He said not to talk much about hand washing and prevention stuff. Actually, that was a tough task and that was a puzzle. How to talk about Corona without prevention? Then something struck my mind from our ancient civilization, Sigiriya. Okay, Corona versus Sigiriya. Is there anything to do with Sigiriya and Corona? No. But Sigiriya versus our presentation? Yes. What's that? If you know about Sigiriya Kurutugi, you know, once a person called Budal wrote a poem saying, Budalmi, Siora Ami, Sigiri Balimi, Gi Bohojana Liuyen Nolimi. So ultimately he wrote a poem saying that I will not write a poem. Same as that, we will be, since many have talked about Corona, we shall not talk about Corona, but we'll be answering your biggest questions today. And that with a healthy dose of Corona as a treat for you all. And we have with us today, Dr. Nusra, pediatrician, who will talk about signs and symptoms. Then Dr. Anesta, physician, will touch upon treatment, followed by complications by Dr. Riyaz, anesthesiologist. From there, we shall proceed to home quarantine, isolation related issues by Dr. Dinesh, who is a general practitioner in Adam. Then Dr. Imthiyas, ophthalmologist in Armed Forces Hospital, will clarify the doubts about prevention. Again, Dr. Dinesh will help us to understand how to live with Corona. This might take about 40 to 50 minutes. Then at the end, all panelists will be joining you all in question and answer session. Okay, did we know anything about the Corona? Or was there any impending threat, any warning signs? Did you all know that last October, the Johns Hopkins Center for Health Security put on a high-level pandemic simulation focusing on fictional global outbreak caused by a novel coronavirus? This I'm talking in October 2019 last year. It was called the event 201. So they were predicting something. Not only that, also the Harvard detected that there was an unusual traffic towards the Wuhan hospital and congestion at the hospital car park in October 2019. So these are the satellite pictures they have taken. So from 2019 October onwards, there were some with evidence, the other, they were doing some simulations. So what happened then? By late December 2019, only the National Health Commission of People's Republic of China reported case of pneumonia of unknown origin. December 31st, the National Health Commission released a notice to avoid public gatherings and to wear face masks when they found 27 cases with pneumonia. January 2nd, they received the first batch of pathogen testing. By the same time, WHO country office in China also got alerts by some media. By January 5th, WHO issued its first report on disease outbreak. Since then, the world was put on knees by corona. So this is their release. 2nd February 2020, the first batch of PCR were dispatched. On 11th February, WHO announced the disease caused by the novel coronavirus as COVID-19. So what is coronavirus? It's a large family of viruses comprising more than 200 types of virus. As per now, there are 7 causing problems to humans, including the well-known SARS, MERS, and the virus we are talking about today, SARS-CoV-2. So you can see the size of this, our new enemy, such a tiny virus causing this much of problem. So you can see the size of the human hair and the size of the virus. By March 11th, the WHO announced that COVID-19 as a pandemic. So what's a pandemic? As you can see in the picture, once the infection crosses the international borders and become a global threat, we call it as a pandemic. So pandemics are not new to us. They are part of our lives. As you can see, there have been many devastating pandemics in the past. So you can see the Spanish flu, there were about 40 to 50 million deaths. HIV/AIDS, we all know since 1981 till present, 25 to 35 million deaths. Compared to those, COVID is still something small, though we feel. So it's up to now, the latest figures is around 720,000 deaths. It's not small, but if you see in the past, 200 million, 56 million, 40 to 50 million. So compared to that, yes, it's relatively small. So why are we at risk of such pandemics? There are many reasons, but to highlight few, I have put up a list, but to highlight few, one is the increased human-animal contacts, which enables animal viruses to jump over to the humans. Then the increased and fast modes of global travel, urbanization, climate change are some other reasons. So how deadly is the new coronavirus compared to its relatives? Few notable differences are, if you see here, the transmissibility, which is depicted by R0, is high in corona. That means it will spread from one person to many. Furthermore, coronavirus is distributed highly in the upper parts of the respiratory tract, therefore expelled easily into the environment. One more factor is, unfortunately, the maximum infectivity is even before someone shows symptoms. So this is why getting quarantined as soon as possible when suspicious and adhering to the preventive methods is always important. What medical interventions are available for viruses? Not many. When a virus arrives among us, as an effective response, we shut down societies, social distancing, and keeping away. Actually, what we are doing is not that different from what our ancestors might have tried to halt an outbreak, though it is a chemotherapy for the global economy. What to do? Unfortunately, that's how we have to respond at the early stage. A vaccine for COVID would be a great relief, yet the process is usually painstakingly long. And I think Dr. Anesta and others might be touching on these vaccines and how it might help. Anyway, the vaccines for measles took nearly a decade to develop, and hit the market 50 years after the US healthcare providers starting monitoring the disease. At present, 25 vaccines are in clinical trials and another 139 in preclinical trials. That's a good news. See how fast it might reach us. Okay, coming back to Oman, as per yesterday's statistics, we have less than 10,000 active cases. That's a good news. Furthermore, compared to the world figures, as you can see, we are doing good at the moment. Compared to 724,000 deaths, 500 deaths in Oman. Not bad. When you look at the graphs, according to the national statistics, we have, it shows, you can see the graph to your right top hand corner. It shows, as if it has peaked and seems like coming down. That's another good sign. Looking at currently infected patients globally, you can see 99% are in mild condition. That's also something relieving. If you know what Stalin said during World War II, even it's true today, I think. When it was few deaths, yes, it was a tragedy. Now, when it is 100,000 and, then it becomes the statistics. How many deaths today? 10, 500, 10,000, as such. Another question, when will life return to its normalcy? $1 million question. But according to the recent survey of 511 epidemiologists and infectious disease experts from US and Canada, what you can see onto the right side of your slide, such as seeing a doctor for an non-urgent appointment, having a haircut, could be expected possibly within a year's time. The things to your left, such as stop wearing a face mask routinely, visiting our elderly relatives, might take more than a year. But if we all strive together, we might be able to change the course of Corona. The good old days, we had a birthday cake after blowing onto it, is a dream now. Anybody blow? I don't think some would even dare to eat that. Thank you. That's an introduction. And so the next presenter is Dr. Nusra. With that small introduction, I will hand over the floor to Dr. Nusra. She will be talking to you about signs and symptoms of COVID-19, and the rest of the speakers might follow her. Thank you once again. Dr. Nusra?
Yeah, thank you very much, Dr. Firaz, for your interesting, awesome introduction. I will be touching on the signs and symptoms of COVID-19. Can you all see the screen?
Yes.
Yes.
So, as Dr. Firaz has already informed, COVID-19 affects different people in different ways. Most infected will develop mild to moderate illness, and it is not requiring hospital admissions. Most common symptoms are currently we face fever, dry cough, tiredness, and fatigue. These are the common symptoms, and there are less common symptoms like aches and pains, body pain, sore throat, diarrhea. Some patients present with conjunctivitis, headache, loss of taste or smell, and rash on skin or discoloration of fingers or toes. Especially in pediatric patients, they have observed this rash on skin entity called Kawasaki disease, which was detected in UK. Many babies who were presented with the disease like Kawasaki syndrome with red lips, skin rash and all, they were treating for that. Ultimately, when they swabbed for COVID, they were positive for COVID, few cases. What are the serious symptoms is difficulty in breathing or shortness of breath, persistent chest pain or pressure, sudden loss of speech or movement, new confusion, inability to wake or stay awake, bluish lips or face. These all are the very serious symptoms. At this time, we have to seek medical attention. So, what are the current testings? Currently, in Oman, we are doing only one test, that is the PCR test for this one. Actually, this PCR test results could be given in 3 to 4 minutes, varying country to country. Like Dubai and all, they are giving just drive-through test. In Oman, we can get it within an hour like that. Now it is like there. Another test is called antibody test. Antibody test is done only for the cases which we are like either for the research purpose or currently we are using the coronavirus treated patients. Their convalescent plasma we are using as a treatment mode. So for those patients to see the immunity basis, that test is done, but it is not only on selective patients. That one not for infectivity, just to see whether that patient was previously got this coronavirus or not. So I just wanted to touch on the guideline of Oman. Currently, this is a case definition which is weekly changed by the Ministry of Health. And currently in Oman, we are not testing all the patients. That one we all know. This one was from end of July. This one has been practicing. So what are the patients we are swabbing and what are the patients we are not swabbing? So it is clear cut given from the Ministry of Health. Whoever the patient is requiring admission, whoever having pneumonia or desaturation or difficulty in breathing or some chest pain or tightness, only these patients whoever requiring admissions are swabbed in Oman currently. All the other patients not requiring admission, they are categorizing into two, either possible case or probable case. If they have a definite contact history, whoever had required admission and they were swabbed and they were positive, these cases are taken as possible cases, and currently they are not swabbed even though they are symptomatic, mild to moderate, even though they have fever or sore throat or whatever, but they have taken as probable case and they are notified and they are quarantined. So these things, this swabbing and everything, it has been, these things are being decided by the government because of this community spread and also because of this high, we can say expenses also, because it is also mentioned in the government site that so many patients are like now coming for swabbing, thousands of patients per day, all asymptomatic and contact history. And to swab these patients, high amount of money is needed and also high amount of staff also required. So now what the government is targeting is only on the serious patients whoever requiring admission. So these patients need more care, and for these patients we need more healthcare workers. So the idea is to spare those healthcare workers for these severely needed required patients. So these patients are not swabbed, and also some patients might come with fever, sore throat, symptoms of COVID, but they don't have a definite contact history. They are considered as probable cases, probable COVID cases, because it's a pandemic. They are also considered as a COVID case, and they are notified, and they are also given 14 days of quarantine, and they have to be quarantined for 14 days. So this is the current case definition. And whoever requires admission and whoever doesn't require admission, this is categorized by the general practitioner, whether they are having low risk or high risk, if they are having the symptoms of coronavirus. If they are high risk, is considered as more than 60 years. If they are having a cardiovascular disease, if they are hypertensive, diabetic, chronic respiratory diseases like asthma, immunosuppressed patients like cancer patients, whoever on immunosuppressive therapy, and whoever had gone through bone marrow transplantations, and these patients, and whoever goes through renal dialysis. All these patients are very, very high risk patients, and the others are considered as low risk, young patients and who are not having comorbidities. And even in these patients, we are categorizing like mild symptoms and severe, even though they have a pneumonia patch. And if it is mild and not requiring hospital admission, they are considered as probable or possible cases, and they are treated at home and home isolation. All the others who require hospital admission, with severe pneumonia, severe acute respiratory distress syndrome, they all are considered as high risk and referred to the hospital admission and treated. This is the current Oman case definition and the treatment. So this is a COVID-19 test result interpretation. I have just put this one, viral testing and antibody testing. This is PCR testing and the antibody testing. So if the PCR testing becomes positive, now actually we are not doing for all the patients. If we have to do it, we have to go and get it done by ourselves, pay and get it ourselves. It is around 70 riyal. So if it becomes positive, what is the management? So you stay home and follow the CDC guidelines, and you have to take the precautions. If it is negative and still you have the symptoms, and still you will have to go for a home quarantine. And if the antibody becomes positive, you had a previous infection of COVID-19, and you may be protected from reinfection, but that one is still not yet proven by any research or anything, because this COVID is a novel virus. And if it is negative, you likely never had this COVID-19, but still there is a chance of getting the COVID-19. But antibody testing positive and the viral testing becomes positive, the PCR becomes positive. This is for the, when we do for the research purpose or something like that, then most likely we have the currently active COVID infection and we can be infective too. So this is unexplained. Maybe we were previously infected and we are having active disease as well. The main safe idea is stay home for 14 days. And if the viral positive and the PCR is negative, we are having current infection and stay home for 14 days. These are the current, and it is only 2 tests currently in Oman. So what is the COVID and breastfeeding? I just want to give a brief idea about this, because this corona doesn't prevent anybody from getting pregnant. This corona doesn't prevent any kids preventing from growing, and we have to live with this corona now. So when a mother, COVID positive mother, delivers a baby, what is done in the hospital? Previously, we were swabbing all the mothers who were having symptoms. We were isolating them, and we put the baby separate and the mother separate, and we had barrier care so that whoever asymptomatic, one family person will be taking care of the baby, changing pampers and everything. Mother was not given access for that, those things. Only breastfeeding with the face mask was advised. But now they say these babies have immunity against this corona. So far, no babies death were recorded with corona. Even in Oman, we had the youngest age is 10 days of baby we had with corona positive, and the baby was treated. Baby presented with fever, symptomatic, and baby got treated. So far, children death in Oman we didn't have. So now the new entity is you have to practice hand hygiene. You have to have a mask. You have to have this cough etiquette, like you use a tissue or something when you are coughing to that, and you throw it then and there. You wash your hands before you handle your baby. Those things and all, you have to take all these measures. But you can safely breastfeed the baby. There is no side effect. There is no definite this one to say no for breastfeeding and COVID. This is the new thing. And this antenatal clinic visits, most of the mothers now, they are really scared to go to the hospital because of this corona. When we go there, we will get infected with corona. This is true because the pregnancy mothers, they are more immunocompromised, and if they get infected, they are prone to get severe disease because they are immunocompromised. But still, this antenatal care is very crucial. They have to do their growth scan when they are like before 3 months. They have to do their anomaly scan at 18 to 20 weeks. They have to do their growth scan in order to see how is the baby's growth and how is the liquor volume, water volume and all. This is very crucial. So you take your protective measures, proper measures, and you attend your clinic visits as advised by your obstetrician. This is very important. please don't miss your clinic visits. You don't have to go unnecessarily for each and every small things, but the special main clinical visits, you have to go. And what about the children immunization? WHO has recorded that 44% of children hasn't gone for immunization worldwide. This is really worrisome because rather than corona, this vaccination, if you miss the vaccination, it could be like deadly disease or very severe morbidity babies can have by some of the missed vaccines. So please, my advice is please go and get your vaccination at time. Please be up to date with your vaccination. Don't miss any vaccination. This is very, very important. So I just have shared some slides from the WHO. This is regarding the breastfeeding, whatever I have told you. Now breastfeeding is safe and newborn can have skin-to-skin contact, and also mother can grooming with her baby. And all women have the right to a safe and positive childbirth experience, and you have to visit your clinic visits, antenatal clinic visits. This is also by WHO, and this is regarding if the mother is too sick. If the mother is too sick to breastfeed the baby, we have now these facilities of this breast milk, expressing of the breast milk and everything with breast pump and all. They can safely, after hand washing, they can express their milk and store it with hygienic measures. And of course, they can feed their baby confidently. If still they are having some problem, they can try for donor milk, and if it is still failed, we will go for formula feeding. It is the last, formula feeding is the last option. And they have to practice respiratory hygiene. This one I have already discussed, wash hands and disinfection. So thank you very much for listening.
Dr. Anesta,
Yes.
it's your turn now, I think.
Yeah.
Regarding treatment.
Can you see my slide?
Yes, you can see. Wait.
Okay, it's starting.
Okay. Thank you very much for this opportunity. And Dr. Firaz.
Play the slideshow.
Hello?
Play the slideshow.
Okay. I'm sorry for that.
Thank you.
All right. Okay.
Thank you.
Wait. Yeah. Today, I'm going to talk about whatever the treatment that we are carried out, especially based on Oman. And Dr. Nusra already told that how was the case definition and what are the criteria that we will think as the high-risk patient and the low-risk patient. Just to remind it, because it is very important, the high-risk patient, the age-wise is more than 60, and some comorbidities like diabetic, hypertension, and some heart problems and kidney problems that we will encounter as these patients having high risk. And as well as the some patients with cancer and who are taking medication just to reduce the immunity, such as the transplanted patient and on the chemotherapy, the patients are on chemotherapy. When the patients come to the hospital, we are categorized, as Dr. Nusra said, according to the radiological finding and as well as the biochemical findings, whether the case is a mild case or a moderate case or a severe or critical care. In critical, severe cases will be admitted to the hospital straight away. But the moderate and mild cases, we will evaluate clinically by a doctor. The mild cases, if the patient is stable clinically, can manage in the home basis. Even the mild cases that we will think about the chest X-ray, if there's any pneumonic patch, the case will move into the moderate case. In the mild case, if you have a high risk patient, that what I have told, we will admit this, we will discharge this patient some medications. basically with some antivirals. And the mild cases, if the patients are symptomatic, only symptomatic treatment. Symptomatic treatment means if you have fever, we will give some treatment for the fever, such as paracetamol. Or if you have cough, some cough suppressants, like that, some supportive measures that we are giving. And most of the time that we are getting 80% of the mild cases. When we come to the moderate cases, if the patient is stable, again, we can ask the patients to be at home if the patient is in the low risk category, which is that nobody is involved with those high risk categories. But high risk category, basically we are admitting and we are observing in the hospital setup. Severe and critical cases straight away to the admission. What we are doing in the treatment wise, as I told, in the mild cases, just home quarantine, and we will advise them to come back if they have any serious symptoms or if it is worsening of the symptoms. In hospital setup, we will give again the symptomatic care and as well as some supportive care, and we keep on monitoring the patient to detect at which time that patient need some interventions. The symptomatic was fever, pain, cough, and sometimes some people are complaining of the hearing difficulties, and we will then and there encounter with the symptomatic treatment. And the supportive care wise, the medication we are giving antibiotic. You may think, why this is a viral infection, why you are giving antibiotics for bacteria. But having said that we are starting antibiotic because we have experienced the people who are with viral illness, they can be superimposed with the bacterial illness as well. Maybe that you have heard about the dexamethasone, because nowadays that everywhere this videos are viraling and dexamethasone is giving very wonderful results, all these things. Yes, it's true, because this is this trial called RICARI trial has been done in the NHS UK. Halfway, when they are conducting the trial, halfway they discovered the dexamethasone is giving a very good results and regarding the morbidity and the mortality rate. And they released the letter regarding the efficacy of the medication. Still that we don't know the conclusion of the study. Only they have tried in patients who required oxygen. In Oman also, we are practicing this dexamethasone. In some cases, such as severe and the critical cases, we are using antivirals according to the evidence base and according to the clinical assessment. And maybe that most of the people are very interested about the plasma, convalescent plasma. Yes, this Oman, that we are in the process of the convalescent plasma, and we are treating the patient, inside patients, especially the severely ill patients, with these strategies. But what is the most important thing is, if the patient is admitted, we are frequently monitoring the patient, the work of breathing wise. How is the saturation and how is the respiratory rate that the clinically. If there's any alarming sign, and we will refer to the critical care units, I think Dr. Riyaz will touch on this topic. What is the best thing that we have observed when we are treating the patient inside the hospital? The pruning and as well as the breathing exercise. This is the key point. If pruning is what? This is awake pruning that we are talking about. I can show you usually that we ask the patients to be in the prone position at least 4 hours, but awake. And the patient has to be actively breathe. And in that case, the lung will get more expansion and it will prevent to go into the critical level. The moderate patient to go into the critical level, we can touch wood, we can prevent it by doing that. And even the breathing exercises. Breathing exercises, we will advise the patients to do the, in hospital setup, we have some equipments, but even though in the home setup, you can use the, as Dr. Firaz said, that we cannot blow the candles in our birthdays, but even though we can practice the way that we are blowing the candles, and that will expand the lungs and it will make, it will support the breathing very well. Regarding the nutrition, in each and every, whatever the illness, we need the good nutritional support to recover, even it's a viral, even it's a bacteria, or whatever the illness. People are talking about the vitamin D, vitamin C, zinc, and whether we have to take it as a preventive, as a prevention methods. To be honest, it has been not proven in any kind of a research. Even the vitamin C, they have tried with giving the intravenously. It has not proven benefit so far to the COVID-19 per se. But in the immune system wise, there's a promising results was before vitamin D, vitamin C, and zinc will give the very boost up the immunity. Vitamin D, nowadays the UK, they are practicing, because it is not like a new thing. In almost all the winter seasons, they are getting the less sunlight, and they are practicing the vitamin D doses. It's at the regular basis, and the same thing they are continuing. It's not related to the COVID or not sure about that. The very good thing is that we have to take care of the mental health of the patients who are in COVID, not only the COVID, and almost all the people who are in this situation. If the patient's mental health is very good and they are ready to fight with the COVID, they are giving a very good results even at the admission, and in the ward setup we have seen the patients like that. We are continuously monitoring, as I said, and as well as the monitoring, we will do the comorbidities, such as the patient is having diabetic, and we are taking care of the patient's diabetic control, and if the patient is having high blood pressure, taking care of the blood pressure, like that we are using. Back to normal life, it's a big question. What is a successful quarantine? Basically, according to the WHO classification in the CDC guideline, now we are telling 10 days of quarantine is enough for the COVID patients to release from the quarantine. But what we will do is, we will assess the patient after the 10 days, whether the patient is having any kind of a symptoms or not. Most of the people, 80% of the suspected cases or confirmed cases or even the probable cases, they will be free of symptoms at the day 10. And at that time, we will safely say, yes, you are free and you will be out of quarantine. But at the 10th day, if the patient is still symptomatic in the sense the cough will be there for some longer period, but even though like fever, that we have to be at least 3 days has to be, the patient should not get fever. At that time, patient should not take any paracetamol or any medication just to subside the fever. Without all these things, if the patient is free of symptoms, that we can safely say that the patient can be out of quarantine. And the high-risk patient, we may consider a little bit prolonged quarantine period because they are more prone to get reinfection, or maybe that that we have observed that they are weak with the infection, and due to that reason, we will tell at least 20 days you have to be quarantined in your home setup. I would like to say about this, some repeating PCR. Usually that Dr. Nusra told about that, how we are not doing all the patients that PCR testing, but sometimes we do the repeat PCR only for a very limited circumstances in the admission setup. If the patient is going for some procedures such as stenting or some surgeries like that. And antibody testing, as Dr. Nusra said, that we will do only for the research purposes and for the convalescent plasma purposes only. A big hope for the vaccine. So far, there are, as Dr. Firaz said, there are 150 vaccines on the process. But we can see that three vaccines which is in front. One is from Oxford, one is from China, and one is from the Russia. The Chinese vaccine, as far as I know, from August 1st onwards, that Abu Dhabi, they have started, they are in the phase 3 trial. Phase 3 trial means they are giving the vaccine in thousands. And once the phase 3 trial concluded, and if it is proven that it is safe enough to be given, and it will be they will get the FDA approval, and it can be used worldwide. Even the Russian vaccine already phase 2 already finished, and they are waiting to launch the phase 3. And Oxford also, they are declared that phase 2 already finished, and they are also waiting to start phase 3 trial. All these vaccines basically in the phase 3 trial. I would like to say about this vaccine. This is the first time this vaccine has been introduced very early to the society. Usually it will take at least 2 years. And this is the first time WHO has given a green light to introduce this vaccine little early. Because last pandemic situations, once we get the vaccine, it's almost the pandemic is faded off. But in this critical situation, it is the special approval has been given. And still we don't know that how the efficacy of the vaccine and what are the major side effects of the vaccine and whether it will be work or not. There are some questions in front of us. But even though, please don't lose the hope, there is a hope as well. We thought about the herd immunity. What is herd immunity? This is that usually at least 70% of the population, if they get either from the disease or either from the vaccine, if they are immunized and they are preventing from getting the virus, then we know that we are safe enough to be in the way back to normal life. That's what we are doing in the immunization program. But if we are rely on the herd immunity by the infectious basis, as Stalin said, that we have to pay a lot of lives, but we cannot do that. That's why that is lockdown and everything, that we are delaying the people who getting the infection till we get the successful vaccine. Ultimately, having said that, you can forget all of the things what we have so far said, but do all. What is do all? I think Dr. Imthiyas will touch that, the prevention. This is the most important factor. I think that we all agree on it. Once the patient, I told you, once the patient's deteriorated, we call the anesthesiologist just to have a look and then move into the critical steps. Dr. Riyaz is the one that is the anesthesiologist with us, and he will be continue the rest of the things. Thank you very much.
Thank you very much, Dr. Anesta, giving a great. Hello, can you hear me?
Yes, we can hear you.
All right. Sure. Hello.
Yeah.
Yeah.
Yes, it is okay.
Hello, I am Dr. Riyaz. I'm working as an anesthetist in Muscat, and I'll be talking about the symptoms and when to go to hospital, and after that, complications and what to expect from the hospital and the invasive ventilation system and all. Now the symptoms, it's different. It's a viral flu, but it affects people in different way. And for those who are young without any comorbidities, they recover with minimal side effects. So they are the people who are doing well in quarantine system. They can be safely at home. There's no problem. After that, they recover. But it's not the case with everyone. Those who are elderly, diabetic, hypertensive, and already immunocompromised patients, they have a severe form of infection. So they end up with a higher mortality rate. So, and when you know the symptoms like cough, shortness of breath, and fever, these are there. But when it is severe, when you know it is affecting your body badly and you can't control, you are taking antipyretics, the paracetamol, the drugs to control, but still it's not settling. The body aches are there, you can't wake up. Or the gastrointestinal system is affected, diarrhea, vomiting and all that. Or new loss of sense, the smell. At that time, you need to seek medical attention. Basically, you should see whether you find difficult to breathe. Difficulty breathing varies. Different people say a different way, but then when you know it's difficult, that means your body needs oxygen. Your lung is not working well. That you have to understand. At that point, you need to go to hospital, seek medical attention. Don't delay there. And it may be some pressure. They say it in different way. I mean, chest tightness, new confusion, and always sleepy, can't wake, it's difficult. Or sometimes bluish lips, face. This is a late sign. That means your oxygen levels are low. Before that, you need to get to hospital. Also, certain any symptom that is concerning you, don't wait for to become very late. You need to go to hospital and get treatment. So also, I just like to say a bit about these complications. That is, like, it's mainly because the virus is triggering your immune system. And immune system, when it is triggered, it releases proteins called cytokines. And enormous amount of cytokines released in the body tissues. It can affect your lungs, kidneys, heart, and then mainly the lungs are affected here. So the lung, the gas exchange part doesn't take place because there is some tissue edema, we call there is some fluid secreted, and the lung alveolar, the sac has to be very thin for the gas exchange to take place. So complications wise, mainly the respiratory complications are there. It can be pneumonia, it can be respiratory distress syndrome, acute respiratory distress syndrome, or it can affect your liver, heart, or secondary infections. When the immunity is low, bacterial infection can come in and it can drop your blood pressure. It can cause septic shock at that time. Vigorously need to treat, and also the muscles can be damaged and the blood clots are formed, and it can be systemically affect your system, and this is very critical at that point. That is called disseminated intravascular coagulation. All our treatment are based on this. We check on these complications and we treat accordingly. We have various blood tests to do to find out how well you're doing. So, like when you get to hospital with breathing difficulty or fever not settling, at that point, COVID team, doctors or healthcare workers assigned for this, they will examine you thoroughly. Already this part, Dr. Anesta has told you in the treatment. So, in the history, they will go into thorough history, like it's a questionnaire. How long you had cough and diarrhea, sore throats, all these symptoms, and or whether you had a direct contact with a COVID positive patient or you have traveled within last 14 days. So after that, they, with the suspicion and the clinical physical findings, they will label, they will decide whether to do a PCR test or not. If you are stable and we can reassure and give treatment and send you home, then we will send. Otherwise, what happens is that we go for the blood test and we admit, and so many proteins are there like CRP, D-dimer, troponin. These are all markers will tell you about the severity of the illness. So baseline, when you come to hospital, we do all this: blood urea, full blood count, all these other basic blood tests, and also PCR and ECG also, just at the baseline level to find out where you stand. And radiological findings like chest X-ray, CT scan, and ultrasound, these are also very useful. And this will show you where you stand at the time you are getting admitted. Then serially we can follow it up. And when it comes to management, it is prevention is the most important thing. So in the hospital also, we even once the patient is admitted, we insist on prevention. We give him masks to control the spread and limit the staff attending the patient, and all those who are attending with full cover of PPE, personal protective equipments are used, and also a lot of supportive care is used. And once admitted, we do serial blood test, D-dimers, which will reveal us more and more how well you are responding to treatment, or whether you are becoming improving, or whether you're not improving. And what we do is we will isolate the patient in the ward in a room, and we'll check the oxygen levels by pulse oximetry. That will show you how much of oxygen from the lungs goes into your fingertip. Means the saturation level oxygen. Normally it is more than 95%, but here even 92, 93% we accept. And also we keep an eye on the respiratory rate, and we speak to patient, and always we are in touch with him, although he's isolated. And he can eat, drink, walk, do some change in position. We give mental support, and also supportive treatment, like we tell him to take deep breathing exercises, spirometry, a small unit we give that will to blow, that will expand your lungs and increase your lung capacity, and also chest physiotherapy whenever possible. Also, treatment includes inhalers when your lungs are constricted, when the gases is not taking place. At the time, bronchodilators we give. Nebulization is possible, we can do with precautions in an isolated room with negative pressure. And also we watch the patient how is doing with our treatment, and gradually if they are deteriorating, what happens is that we'll have to give oxygen, and maybe we have to go up to mechanical ventilation. So what happens is, this is the lung. You can see here the lung is there. The left side, this diagram, it is the normal lung. We have alveolus. That's the place where gas exchange takes place. This is a sac. So oxygen, the breathing air, the oxygen comes here, and the blood takes up this oxygen and goes, and the blood gives carbon dioxide. This is the gas exchange taking place in the lungs. This is not taking place properly. This is the main issue with COVID. So this the right side of the slide, what you see is a COVID alveolus. Here, inside there is a jelly-like material. These dead cells are there. There is a fight between the body and this virus, and this membrane is thick. And so when it is thick, the gas exchange doesn't take place. So we are finding difficult to give oxygen. This is the main issue. So they find difficult to breathe. At this point, we have 3 ways of handling. That is, now the patient breathes and oxygen comes in. This increase the concentration of oxygen. That is one way of treating. That is, we call FiO2, fractional inspired oxygen. In the ambient air, what we breathe is 21% of oxygen, we all know. So with difficulty in A, we have to increase this percentage from 30, 40, 50, or up to 100% we can go. At times, it doesn't work not by increasing oxygen. We have to give oxygen in a pressurized way. That is the positive pressure ventilation. That also increases the oxygenation. From here, the oxygen gets into the blood. The other thing, as already mentioned, the pruning. Pruning, you can see when this fight takes place between the virus and the body immune system. This patient is facing upward, and this patient is facing downwards. Here, this is a cross section of this patient's lung, and you can see that this is heart and this is spine. And here, this part, the dependent part of the lung, which is the most important gas exchange taking place, there are a lot of debris, lot of jelly-like material settles. So by pruning, what we do is we get this to the front part. The back side, the posterior side of the lung is free to gas exchange. So there is more gas exchange taking place, more oxygen getting into blood, patient feels comfortable, and oxygen requirement also comes down. And here we can, this slide shows how the patient deteriorates and what mode of treatment we have regarding ventilators. Now we see this from step 1, 2, 3, and 4. So this side is the mild form of COVID, and here the lungs are getting affected, and our treatment strategy also increases. So the step 1 is a normal patient who had COVID, and then here with little bit of oxygen, let's say about 3 liters per minute, with a nasal cannula. He is managing, and saturation monitor in a room can manage. This is in the normal ward we are managing. And when the condition deteriorates, what happens is that this won't do. This nasal cannula oxygen is not enough. So what we do is that, as I told before, we increase the FiO2, fractional inspired oxygen concentration. So that is by a high concentration mask with a reservoir bag. So we give, it increases the delivery of oxygen. So patient gets more and more oxygen, is comfortable. And from this point onwards, if we deteriorates further, what we do is, now we have increased the oxygen concentration, we have to give pressure. That is continuous positive pressure ventilation. That is by a ventilator with a tight fitting mask with a positive pressure. We give positive pressure means we are giving forcibly air into the lungs. So that is a step 3. And if that also doesn't work, then we have no choice but to intubate. That intubation needs endotracheal tube, a tube that we pass into your breathing, the windpipe, that we connect it there to the same anesthetic, this ventilator mesh, and we give oxygen in this manner. So actually intubation is easy, but extubation is difficult in COVID. Once intubated, it is all critical care. We have to sedate and we manage as a patient with our muscle relaxant and everything. So this point onwards, if the lung still doesn't work, if there's no gas exchange taking place, the last resort is extracorporeal membrane oxygenation, that is called ECMO. That is like dialysis for kidney. This is ECMO is for lung. So now when the patient recovers, if he responds to our treatment, what happens is from step 4 to step 3 we can come down. In step 3 to step 2 we can come down. Like that, and from step 4 to step 3 means we extubate the patient, and then we give non-invasive ventilation, and then mask, and then with nasal cannula. I would like to say a little bit more about pruning. Pruning really helps. How it helps? It increases the surface area. But still, there are certain limitations. There is spinal, if the patients having spinal instability, or if there's any tracheal surgery, or any open wounds are there, or pregnant patients more than 6 months, at that time it's difficult for them to be prone. But still, they can turn their body to left side or right side, like that, time to time, so that what is settling at the dependent parts of the lung, it's moving, and get more and more oxygen there, and the oxygen requirement comes down. We have practically seen pruning has produced very good results. So this is called awake pruning, when the patient is awake. So this is 3 hours for like that. According to the patient's support, we can manage. But in intubation patient is different, because we need more staff to turn. So there are about 16 hours of pruning we do. That also has given a lot of improvement. So pruning is good, but meantime it has also some risks. That is, as you can see, the pressure falls and the patient is unable to speak, and the skin injuries can be there. Say, our full ventilation is dependent on this tube. This tube might kink, and it can come out. and blood pressure can crash, and a lot of heart rhythms can change. These problems are also there, but we have to keep it in mind. So basically, critical care management in COVID, it's once the patient is intubated and is there, he won't tolerate the tube. So we have to sedate him, give analgesia, and also some drugs to cause him muscle relaxation. And also the antibiotics, time to time we do cultures, and with the reports, we can escalate the antibiotics, and also we need to give IV fluids, vasopressors, sometimes cardiac support medications. And once intubated, we have some goals for ventilation. That is, we accept the saturation of 92 to 95%, that is blood oxygen levels of 70 to 80 mercury millimeters, and also the carbon dioxide levels, and also the ventilation pressures, plateau pressure 30, like that. And with the other medications, now we said clotting is a problem, so aspirin and anticoagulant heparin or low molecular weight heparin, and also immunomodulators, steroids, all have a role to play here. And then early feeding, we continue nutrition, and whenever possible, oral feeding we continue. Otherwise, total parenteral nutrition is there in the critically ill patients. And we try to extubate early. That produces more and more good results. But we are not able to do in every case. Certain cases end up in tracheostomy. Tracheostomy is a tube opening in the trachea, the front, to make a hole. That helps us weaning, help us to recover the patient fast. So, as you know, once the patient is admitted and then becomes critical, it's very, very difficult to handle. So, all what I can say is take preventive measures. Once, if things can be prevented, people can avoid all these issues. Thank you. I think Dr. Imthiyas is there to talk about preventive measures. Hello? Are you there?
Yeah, Dr. Dinesh, no?
Yes, thank you, Dr. Riyaz. I will be taking over the floor now.
Thank you.
So, you can see the slides.
Not yet, Dr. Dinesh. Not yet. Yes.
You can see now?
Yeah.
Yeah, basically from now onward, I'm talking about how to provide the home care for the suspected or patient with mild symptoms. Okay, the WHO recommend for all cases, all cases that are positive COVID-19 to be directed to health facility, ideally. But depending on the certain circumstances, we are asking the patient to be quarantined at home. This is what we basically we should identify why we are asking the patient to go for home isolation. If the illness is mild, if the patient is symptomatic but no longer required hospitalization, or depend on the decisions has been made by with the refusal of hospitalization or availability of the unsafe and the capacity and resources, we are going for the home isolation. This diagram shows the spaces normally when during the home isolation the patient going to have his own room will well ventilated, and living area, kitchen, and bathroom. The room should be preferably should be a single room, and it should be well ventilated. And if you have in the air conditioned, keep it running. Clean the room, clean room, and you have to have the clean bed linen. Ideally, it should have the attached bathroom, and in the bathroom, keep the exhaust fan on. And separate the. You have to have a separate bin for your food and clothes, and the garbage will be dealing next lecture. And also, you can keep inside the room your hand sanitizer and tissue for single use only. If you are sharing the same room, you can share it, because if you don't have another room to be isolated, but you have to keep at least distance 2 meters from the other house members, but make sure you are using the mask. So if you have symptoms at home, inform your relevant persons, inform your house members that you're going to be quarantined, and you are going to be quarantined for 10 days, like that. You have to inform the relatives as well. So if you develop the symptoms while you're on duty, inform your immediate bosses, and you are entitled for sick leave for almost 10 days. You are getting the sick leave for home quarantine. So I mean, you have to stick for the basic precautions, and you have to have the mask, and you have to go with the proper way of hand washing, which will be dealt in the next lecture. So inform house members and ask them to prepare the room. If you're at duty, ask your wife or someone who's living at home that you are going to be quarantined and that you are coming, and prepare keep it prepared. Don't let high-risk persons, especially the elderly people, more than 60 years of age, and who's having any comorbids like diabetes, asthma, like that. I mean, they should not contact with you, and kids and pets as well. Keep your belongings, whatever you are carrying from your office to home, with you only. The wallets, car keys, and phone itself, you have to carry with you until you reach your isolation room. Minimal surface contacts reduce the transmission. It will reduce the transmission. Don't try to touch so many surface from the doorstep onward, and whatever you are carrying, it's infective. It can transmit the disease. So keep in mind, even the shoes, your clothing, whatever you are carrying, it tend to have infective. So it can transmit your disease to another person. So make sure until you reach your isolation room, minimal surface contacts. Always, once you're in the room, always use proper surgical mask. You can see in this picture clearly what are the basic things you should have inside the room. You should have a disposable mask, tissue box there, and there's a waste bin, and separate chair and a table, and the clean bed linen. Always limit the movement inside the house. I mean, once you minimize the space sharing, it will reduce the transmission of disease. If share in the same room, as I said before, you have to keep at least 2 meters. At least you have to keep 1 meter, ideally 2 meters. Once it comes to caregivers, limit the caregivers. It's better to have single caregiver, and don't appoint a caregiver who's having high risk, like elderly people who's having any risk conditions. Don't let them to handle the vulnerable patients. And always make sure no visitors during this period, no gathering, no parties. Perform hand hygiene in between. Always make sure the hand hygiene should be before and after preparing food, before eating and after using the toilets. Whenever hand looks, you feel like it's dirty, you have to go for hand hygiene. It should be proper hand hygiene. It will be dealing next. This diagram you will see how this is the left corner, the caregiver, the right side is the patient. Both were in the face protective face mask, and the caregiver, he's cleaning the surface with disinfectant before keeping the food on the table, and he's wearing proper gloves. And always make sure once you've done everything, once you've given the care for the patient, always remove the mask and put into sealed bin. And the garbage handling, how to handle garbage, I will be dealing next. And always remember these the gloves and the mask. You should not touch the front side. Do not smoke during your home quarantine period, because it's lead to a certain the conditions, especially people who are with asthma. It's not good. Like it will worsen the condition. Always make sure you have the separate, dedicated, linen, bed linen, eating utensils, and do not share, especially the toothbrush, toothpaste, and cup and saucers, and the bed linen, the towels. Don't share. The patient should have, the patient or suspected person, a suspected house member should have a separate items for them. Always try to clean and disinfect the surface. The mostly you will touch, the commonly you will touch the surface that you touch daily, like table, top table, the headrests and chairs, door locks, door handles, and the toilet surface. You have to frequently clean, and you can use 0.5% sodium hypochlorite solution for that. Always make sure the regular household soaps and detergent used for the cleaning, and then rinse it, then apply the 0.5 sodium hypochlorite, because this action correctly happen once it's cleaned with soap and detergent only. Always make sure the laundry, especially the laundry when you're having the patient or suspected person home, wash the patient clothes, towels, and bed linen separately. And when you are carrying, don't soil linen against your body. Don't carry the clothes that already contaminated against your body, because it will contaminate more. You will contact with directly you are contact with that one. So don't carry the linen against your body. And always make sure the secretions, body fecal matter, vomiters, secretions, always you have to remove and dispose into toilet before cleaning. And ideally, if you're using a washing machine, the temperature should be 60 to 90 Celsius. You have to use for washing the clothes. If you don't have the hot water, but you can soak the whole the contaminated linen in 0.05% chlorine. Approximately, you can keep for 30 minutes. Then you can wash it. During this period, so what you say, suppose you are in your home quarantine. During this period, if your symptoms get worsened, always make sure inform your caregiver, inform your the health authority. You can talk to the relevant through relevant hotline and get medicals. You can get medical advice. Always, when you are in the room, when you are in home quarantine, stay active. Engage with the physical activity, the exercise. To have adequate sleep, and go for healthy meal. It's normal to feel sad and angry, stressed up during this period. It's normal, because you are going to be 10 days in one room. You will get these symptoms, but it's normal. But to get out of those things, get in connect with your family, friends. You can call someone, you can go for social media, you can watch videos, movies, like anything you can watch. You can keep interaction with others. The one thing I want to stress is always get information from the proper channel only about COVID-19 and about the COVID-19, especially from the WHO or near country health authorities. And again, I will go for this is basically how you're going to manage your waste during the COVID-19 season. This lecture, I mean, I will be briefing how to identify your the garbage, different types of waste, basically. The biggest challenge we are arising from the household waste, and why we should more concerned about the garbage, because there are few studies going on. We don't have the clear cut, I mean, the evidence how many days it's going to last on surfaces, but so far it says in the plastic and stainless it lasts for 3 days, and on cardboard about a day, but it's varying. It's about on the surface it's varying. It's controversy about 3 days to 9 days. How to stop and spread the community. That is the main idea behind of this lecture, what I'm going to deal now. Identify your I mean garbage. The one we have 3 types. The one thing, biodegradable. It comes to kitchen waste, garden waste, and food waste. And biodegradable, it's paper, plastic, metals, and bottles under non-biodegradable. And this is the main thing, the domestic hazardous. The mainly you will produce the mask, face mask, disinfect. I mean the already contaminated gloves. If you're the patient is as diabetic on insulin, the syringes, those stuffs comes under domestic hazards. If the patient on any medication, this medication also comes under for domestic hazards. This is basically the one summary I'm giving, like when it comes to COVID season. These are the waste in one the waste, mask, infusion bottles, goggles, kitchen waste, like that. How are you going to dispose the garbage? You have to segregate beforehand. And always segregation should be a different way. In the biodegradable one, you should go for ideally it should be a green bin. And now non-biodegradable ones, the bottles, the glass, metal items, you should be the green bin. And this is the most important, the domestic hazardous one. You have to put in the yellow bag. The yellow bag should be a thick, where you can tie it, I mean what we call leak-free bag. At the same time, because we have to, I mean, once you segregate, once you collect these garbage, normally we have to protect our other household members, as well as scavengers, urban authorities, and the Balade people, municipal council people who are handling, because we should, I mean, protect it being spread to others. Always get in touch with urban local bodies before it's disposing, and you have to be wise when you are, I mean, segregating the waste as well. Always label what's inside. It should be who am I? I mean, it should be mentioned. These are the hazardous. It's hazardous. I mean, you have to label it. And the other thing, keep all waste at least for 3 days before disposing, and keep in a dry place. Avoid contact with children and pets, because the pets I mentioned here, there's no, I mean, the clear-cut evidence that been transmitted through pets, but the pet fur, I mean dog fur, like, I mean, they said like there's a chance of surviving on the fur. So better not to contact with pets and children during this time also, especially the patient, as well as the garbage what we handle. As I said before, label the susceptible waste as hazards. Be in touch with garbage handlers, and always protect is transmitting, and this leads to a happy family and happy ending with after this critical corona period. And thank you so much. Okay, I think Dr. Imthiyas.
So yes.
Can you hear me? Can you see the slide?
Yeah, we can see. Also, we can hear you.
Good evening, everyone. I'm Dr. Imthiyas, ophthalmologist. First of all, I would like to thank Sri Lankan Quantity Survey Association for organizing this webinar. Today, my outline of presentation: how COVID-19 spread, how to prevent it, how to live healthy life, improve our immune system. How COVID-19 spread. You can see when we talk, sneeze, release sort of markers. These are all droplets. Now, the droplets, if it is more than 5 microns, it's called droplets, and if it is less than 5 microns, it's aerosol. And these droplets form the surface, and it's called fomites. Why it's important? According to this, they divide mainly 3 modes of transmission. One is person to person, that is a direct from droplet and close contact. Another one is virus contaminated surface to person, indirect from the fomic transmission. Another one is aerosol or airborne transmission. Other mode of transmission, feces and urine, bloodborne, intrauterine, pregnant mother, breast milk, foodborne, animal to human transmission. So far, not enough evidence. Need more research on this field. Human to animal transmission possible. So we will discuss each and every very quickly. Direct person to person contact and droplet transmission. Already I explained this. These droplets approximately travel in the air 1 to 2 meters and settle on the soft surface. This is the reason person to person spread is happening mainly between close contact. The more closely person interact with others and the longer that interaction, the higher the risk of COVID-19 spread. Indirect virus contaminated surface to person is called fomite transmission. This transmission may also occur through touching surface in the immediate environment or object contaminated with virus from an infected person. For example, a stethoscope, thermometer, followed by touching the mouth, nose, or eyes. The New England Journal of Medicine published the virus survival time on different surfaces. You can see here, this is the air up to 3 hours, on copper up to 4 hours, on the cardboard up to 24 hours, on the plastic and the stainless steel surface 2 to 3 days. This airborne transmission, here some medical procedure performed in the hospital generates tiny particles. These are called aerosol. So when someone doing this procedure, if not wearing proper PPE, he can get the infection. This is the airborne transmission, and healthcare workers who are doing this, they should take proper airborne precaution. Airborne transmission, absence of aerosol generating procedure. This is mainly explained particularly in the indoor location where there are crowded and inadequate ventilated space where infected patients spend long period of time with others, such as a restaurant, during choir practice, places of worship, fitness classes, places of work where people may be speaking, singing. So this in this outbreak, short-range aerosol transmission cannot be ruled out, but it can be mixed with droplet and again this pomade transmission also. So this is the where still we don't have very clear-cut idea, but need more research on this field. Other mode of transmission I already explained. There is no still clear evidence. Spread between animal and the people. From the animal to human, still no clear evidence, but from the infected person to mammals, including dogs, cats, and farm mink, there are reported cases. Okay, now we understand how it spread. Now we can break the chain of spreading. So that is what how to prevent COVID-19. There is currently no vaccine to prevent coronavirus. So best way to prevent illness is avoid being exposed to the virus. Everyone should wash your hands often, avoid close contact, cover your mouth and nose with mask when around others, cover cough and sneezes, clean and disinfect, monitor your health daily. These other two already discussed. I'm not going to discuss in detail. Wash your hand often with soap and water for at least 40 to 60 seconds. If soap and water is not readily available, use hand sanitizer that contain at least 60% of alcohol. Cover all surfaces your hand and rub them together 20 to 30 seconds until they feel dry. Here on left side, you can see the steps of hand washing. It is for hand washing or with the alcohol sanitizer, also same procedure. Everybody know this, but this is very important, so I will explain this word. Wet hand with water, apply enough soap, cover all hand surface, rub hand palm to palm. Right palm over the left dorsum with interfingers and vice versa, palm to palm with fingers interface. Back of fingers opposing palm with fingers interlock, and rotating, rubbing left thumb clasp in the right palm. Again, you have to do the other hand also. Rotational rubbing backwards and forwards, clasp finger, right hand in the left palm. Again, you have to do other end. Rinse hand with water and dry thoroughly with single-use towel, and use towel to turn off the faucet and dry your eyes. Now your hand is clean. This you have to do when to wash your hand. It is especially important wash before touching your face, before eating, preparing food, after eating, after using the restroom, after leaving public place, after blowing your nose, coughing or sneezing, after handling your mask, after changing diaper, after caring someone sick, after touching animal or pets. Don'ts with unwashed hand: do not touch your eyes, nose and mouth. Do not shake hand. Now we'll move on to the next one, social or physical distancing, avoid close contact. Outside your home, maintain at least 2 feet distance between you and people. This is the 2 meter or 2 arm length. You know the reason already I explained. Inside your home, avoid close contact with people who are sick, avoid going to crowded place, avoid traditional greeting method like hugging, kissing. Cover your mouth and nose with mask when around others. You could spread COVID-19 others even if you are not feel sick, asymptomatic and pre-symptomatic. The mask is meant to protect other people in case you are infected. In the left side, you can see COVID-19 carrier and healthy person. If both are wearing mask, there is a low risk, and if one person wearing, there is a medium risk, and both are not wearing, there is a high risk. You should remember here, the mask is not substitute for social distancing. And these are the mask type commonly used. This is the fabric for paper mask and the surgical mask and N95 mask. Usually this WHO and US CDC recommend fabric and the paper mask for general public, and surgical mask healthcare workers and patient in healthcare setting. N95 respirator healthcare workers only. We'll see more about the type of the mask. You can see mask type, standard and filtration efficacy. the single-use face mask, surgical mask, and respirator, these standards are coming from China, USA, Europe. And this filtration efficacy 3 micron and 0.1 micron. Here, bacteria filtration efficacy and particle filtration efficacy standard. According to that, you will have this single-use face mask from China. It will not protect from particle filtration efficacy. And surgical mask, you have Chinese one and USA and Europe, and there are levels and types. And respirators, USA standard 3M and 95, and Chinese one KN95, and the Europe FFP mask also available. These all masks are available in the market. Who should wear the mask? General public above 2 years should all wear the mask. People who know or who think they might have COVID, preferably surgical mask. Caregivers of the people with COVID-19, surgical mask. Healthcare workers, against surgical N95, KN95 or FFP 2 or 3. Who should not wear the mask? Children under the age of 2 years, anyone who has trouble breathing, anyone who is unconscious or otherwise unable to remove the mask without assistance. So how to wear non-medical fabric mask? These are the simple steps, but still I want to explain here because this preventive measures are very important. Clean your hand before touch the mask. Inspect the mask damage or if dirty. Adjust the mask your face without leaving gaps on the side. Cover your mouth, nose and chin. Avoid touching the mask. Clean your hand before removing the mask. Remove the mask by the strap behind the ears or head. Put the mask away from your face. Store the mask in a clean plastic reusable bag if it is not dirty, wet, and you plan to reuse it. Remove the mask by the strap when taking it out of the bag. Wash the mask in soap or detergent, preferably with hot water at least once daily. Clean your hand after removing the mask. What are the don'ts? Do not use masks that look damaged. Do not wear the loose mask. Do not wear the mask under the nose. You can see many people wearing like this mask today. Don't remove the mask where there are people with 1 meter or 2 meter. Do not use mask that is difficult to breathe through. Do not wear dirty or wet mask. Do not share your mask with others. How to wear medical mask? Again, same, but medical mask, it is not reusable. You have to throw it. Again, the don'ts are same for medical mask. So, other preventive measure is a respiratory hygiene. Cover your coughs and sneeze. Always cover your mouth and the nose with tissue when you cough or sneeze. Use inside of your elbow and do not spit. Throw used tissue in trash. Immediately wash your hand with soap and water. If soap water not available, clean your hand with hand sanitizer. Again, clean and disinfectant. This part Dr. Dinesh already discussed in detail, so I'm not going. So frequently touching area you should clean with proper detergent. Monitor your health daily. This also the symptoms and dangerous sign when to reach hospital, all discussed with our previous colleagues, so I'm not going to discuss. We'll come to the gloves. For the general public, wearing gloves is not necessary in most situations. When to wear gloves? When you are routinely cleaning or disinfecting your home, when caring for someone who are sick. Wash your hand after you have removed the gloves. Okay, we'll move on to the next major topic, how to keep healthy while in isolation and quarantine. Dr. Dinesh also touched this one, so I will go very briefly. Eat a balanced diet. Is a balanced and varied diet. Establish routinely. Practice mindful eating. Keep hydrated. Practice safe food hygiene. Stay active at home. Get enough quality sleep. Get information from trustworthy sources. Balanced and varied diet. There are no food or supplement that can boost our immune system and prevent or treat COVID-19. Eating a well-balanced diet with plenty of fruits and vegetable, whole grain, plant and animal protein, healthy fat is best way to get all essential nutrition we need for good health, normal immune system. 7 tips for mindful eating. Take a small bites, chew well, Sit at the table. Put the fork down between bites. Do not eat straight from the packet. If you feel full, save it for later. Remove distraction. Pay attention to the smell, taste, and texture. Keep hydrated. Keep hydrated. Essential for overall health. How much water we need depend on our sex, age, weight, level of physical activity, and environmental condition. Here you can see the adult male need at least 2 liters of water and woman 1.6. Children 1 to 13 years from 1 to 1.7 liters of water every day needed, but it will change with the environment. If the environment is hot, you need more. Practice safe food hygiene. According to European Food Safety Authority, there is currently no evidence that COVID-19 is transmitted through the eating food. However, good food safety practices are important to minimize risk of foodborne illness. When preparing food, make sure to wash your hand. Already I discussed about it. Respiratory hygiene. Wash fruits and vegetables before eating them. Disinfect surface and object before and after use. Keep raw and cooked food separate to avoid harmful microbes from raw food spreading to ready-to-eat food. Use different utensils, chopping board for raw and cooked food, prevent cross-contamination. Make sure to cook and reheat food to adequate temperature, more than 72 Celsius for 2 minutes. Stay active at home. Physically activity benefit both body and mind. Healthy adults should aim for at least 30 minutes daily physical activity and at least 1 hour for healthy kids who are aged between 5 to 17 years. Follow these tips for staying physically active during self-isolation or quarantine. Plan time for physical activity in your day. Take regular breaks from sitting by standing up and stretching, going for quick walk if permitted. Follow online exercise class. Think outside the box. Activities like dancing, playing active video game, cleaning the house, playing with your kids, all account physical activity. Get enough good sleep. A lack of sleep can negatively affect both our physical and mental health, as well as reduce our immune system ability to fight off infection. The amount of sleep we need depends on our age. In general, adults should aim to get at least 7 hours of good sleep per night. You can see a different hours of sleep need by age. Here are some tips to help you improve your sleep. Establish a regular sleep schedule. Limit alcohol intake and do not smoke. Avoid caffeine before bedtime. Exercise regularly. Use comfortable, inviting bedding. Keeping your room quiet, dark, and comfortable temperature. Disconnect from electronic before going to bed. This is the practice everybody these days. In the night they are working with the electronics. Try relaxation techniques such as meditation. Get information from trustworthy source. There is a lot of misinformation surrounding COVID-19 on internet and social media. It is important we get our information from reliable, trustworthy source such as government website of trusted national, international organizations such as WHO, US CDC. Take-home message: COVID-19 is new virus, not much known. So far, no vaccine available. More than 100 vaccine trials ongoing. Already discussed this Russian, Oxford, Chinese, and India. Only solution is prevention. Everybody should follow everything. Wash your hand often. Avoid close contact. Cover your face, cover your mouth and nose with mask when around others. Cover cough and sneezes. Clean and disinfect. Monitor your health daily. Take balanced diet, enough hydration, good sleep. Live physically and mentally healthy life. Thank you very much. Now Dinesh can.
Thank you, Dr. Imthiyas.
Thank you.
Thank you very much, Dr. Imthiyas. I think is it question and answer session, isn't it?
We have a very small presentation by Dr. Dinesh.
Okay.
I think for a few slides, then it's open for the question and answer.
Yeah. Okay. Thanks.
Sorry for the timing, but it will be a very short presentation.
You can see my slides.
Yes.
Yes, Dr. Dinesh.
Okay, this presentation I'm going to talk about how going to live with COVID-19, because you can't skip from, you can't say no, you have to live with the COVID-19. So basically, I'm mainly touching up the shopping, how you do the shopping, and some of the things we're handling at home. So the mainly once it comes to shopping, the WHO recommend if you can go for online purchasing, and because you will get the stuff at your doorstep. So that's a better way of going for shopping during these days. But people tend to go for personal day attending for shopping centers. So before start your shopping, better to have one person to do the shopping and for going for marketing and everything. So prepare the main list at least for 2 weeks or 1 month, like the dry ration separately and the other stuff separately. Have a list, common list before you start on your shopping. And before starting, use proper mask. The main thing I want to stress to you, point at you, like people are trying to use the gloves during shopping. It's not recommended to use gloves during shopping, because you will be safe, but you will be contaminating the other stuff, and it will tend to infect the other people from your gloves. So use personal hand sanitizer while you do the shopping. Before starting the shopping, that the people in front, they will do the cleaning, the handle of the trolleys and the buckets that you're using. So always keep 1 meter. Hello.
Yeah, doctor, we can hear you.
Yeah. Always keep one meter distance from other when you are while you are doing the shopping. Always make sure that you will not touching your eyes, mouth, and nose during this process. During the period of a shopping. These are the main thing you should. I'm highlighting. Minimize selection of items. People tend to take one stuff and look into the this thing, and again keeping the stuff on the track. It's not good. Minimize repeating the contact the same items on the store rack. So once reach home, wash your hands with soap, and don't let your kids to handle anything before you it been segregated. Even as I said before, whatever the things you are carried from outside, it's infective. Make sure keep it that in mind. Don't keep your car key one place, the wallet in one place, and the children and everyone will try to touch those things. Make sure everything you carry once you carry inside the home, keep in a safe place that the kids can't reach those items. The main thing I want to tell you, if you go for the milk packet, there's a outer cardboard packet, inside there's a cellophane, separate packet as well. So once you reach home, remove the whenever possible, the cardboard packaging you can remove, and you can remove the cardboard package. You can keep it, put into a separate bin, separate covering, and the vegetable covering also you can remove, and the vegetable and everything you have to wash in clear running water. Don't use any disinfectant for the cleaning of meat item or vegetable items. This is, you should understand. You should never use soap or any detergent or any disinfectant for cleaning food items. And canned beverages, bottles. You should not. You can wash with water and wipe it, but make sure, because we used to have, like, we used to go with the car and stop outside the restaurant asking for tea, chai from before. But these things you should, if you can avoid, it's better, because the handler, the restaurant people, they will give you the tea cups to you, but you don't know whether the person infected or not. So better not to go for that habit now. You have to stop it for a moment. And even outside when you go for the restaurant asking for the burger or sandwich from the restaurant, it's better if you can stop. So how you going to pay for the bill? So better use, let's say the better use if you have the credit card, it's because there are mechanisms that you can touch and you can pay. So if you're using the coin or the coin or the other money, I mean, there's no clear-cut evidence that it's been that the COVID-19 has been spread and I mean transmitted through coins and the money that we are handling. But there's a chance. So better avoid. I mean, better if you can pay through credit card or some other card. But I mean, sometimes you have to deal with this one. So as I said before, before the handing out the material, the linen and everything, the clothes, you have to wash it properly. You have to wash. If you're the positive patient with the suspect patient, you better to have a temperature of 60 to 90 Celsius. If you don't have, you can soak it 0.05 sodium chloride, chlorine solution before it wash. But you can go for a normal washing as well. This is basically I want to stress you, and I think presentation flow up to you now.
Yes, I think we have done with presentation.
Yeah.
We can take up
Yes,
few
thank you
questions.
very much, Doctor. Any one of the attendees, if you have questions, please, it's open now. Until anyone raise the question, I have one question for the quantity surveys. Usually they are working with the sites, site setup is with porter cabins and labor cabins are there. Lot of interactions with the laborers and outsiders. If you can advise the quantity surveyors who working in a cabin with another 2 other people, their laborers coming to see them, water and the tea served by another labor or somebody. So what you can suggest for them?
Dr. Dinesh, you will take it.
As I said before, I mean, better these days, like you can explain to him, like if you're not, if you, I mean, if you take the tea, I mean, what they, I mean, providing you, and you can explain them the reason why, what's behind. So I do feel the same, like the same thing I've explained before. If you go to the restaurant and you're eating the car outside, even you are taking the tea from the restaurant, the same thing. There's a tendency to get infected. So I have seen some people after drinking the tea, after consuming, they're keeping the cup back on the tray. So it's get cross contamination. So better to avoid these ones, I do feel.
Yeah.
And another point to adding to that point, in the porter cabin setting is considered as a closed area, and always follow all the preventive measures. Advise them to wear the mask, hand wash, clean the frequently touching surface, and all preventive measures what we mentioned is very important.
Thank you very much, Doctor. Any other questions from audience? Yeah. Chulendra Kumar, can Ishara, can you allow the microphone?
Hello.
Yeah.
Can you hear me?
Yes, we can hear you.
Good evening. My question is these days it's better to do the outside exercise as a normal person because we are wearing the mask. It is better. It is very difficult to wear the mask in long time, no? So it's better to outside exercise is good. No?
Shall I answer this question?
Yes, Dr. Imthiyas.
This outside, the wearing mask strictly advised now WHO and CDC outside. But there are some feasibility, people who are doing exercise vigorously. There is, when you wear the tight mask, there is a lack of oxygen supply. But so in this situation, what we advise, maintain social distancing at least 2 meters, and that other preventive measures, and you can do the exercise. But if you are doing mild exercise like walking and all, you can wear the fabric mask. It won't cause much this oxygen deficiency or anything, and it can absorb the even sweating and all. So it the where you do the exercise and how is the crowd all depend on that time. So if there is no much crowd, there you can maintain physical distance, and you can do exercise without the mask. But if you are in anyway, the gym and all closed areas are not advisable these days to do the exercise. Anybody want to add? Please add this one. What I read.
Yeah, but I think that we have to obey the commands, whatever the rules and regulation where we are. And I think that Oman, they have already told that we have to wear the mask. And in that case, I think that it will be a legal issue if we don't wear the mask and do the exercise in the outside. This local authority, the rules and regulation, we have to obey. That is the...
Okay, thank you very much.
Thank you very much, Doctor. Anybody else? If we found any infected person in office or after he left the office, or say we can send him to quarantine, but what kind of sanitizing procedure we can follow to sanitize the office?
Who wants to answer this? Can I take up the question? Yeah. If it, depending on there are several available options. One is, if you have the best one would be the hydrogen peroxide fumigation. That is the easiest way. So even in that, there are different machines which will atomatize the hydrogen peroxide molecule into different particle levels. So the best one would be if it is like up to, if they can break down that up to nanoparticles. So like in a hospital setup or in office, we'll say somebody came without mask, he coughed and sneezed and left the office. Now, okay, the surfaces we might be able to clean with a peroxide or chlorine, whatever or soap and water, if whatever is possible. But if immediately you want to enter the room again, as Dr. Imthiyas said, there is a short period of aerosol or airborne infectivity in the environment. So to prevent that, you might be able to use hydrogen peroxide if it is available. If not, then at least you have to keep the room closed for 3 to 4 hours. And then once you enter with all the precautionary measures and all the surface areas practically possible, you have to disinfect. So that would be what you can do practically. I don't know whether it's clear. Did I make it clear?
Yeah, doctor. There's a hydrogen peroxide treatment.
Yes. Yes.
How we can do that? It is a gas.
Yeah, there is a usual. Yeah, usual. It is a liquid. It comes as a liquid. The concentration what we are using is 5 to 6%. So there are different types of machines like fumigators, and some are there which can create nanoparticles also. If it is like nanoparticles, if the liquid be like almost like a gas, you might not see anything. Even you cannot see like something. You will not be able to see anything. The other one, which is the fumigators, it is like you will make like a steam or like a smoke. That one you can see the particles. So, but that will not penetrate, or it will, to up to a certain extent it will cover, but not the penetrative power is not as good as the nanoparticles. But practically, whatever we can use. Even fumigators, I think it will be, because these are, we are talking about the office and home environment, not as much as contaminated like hospitals. So you can, if available, you use the fumigator. If not, you leave the room for a couple of hours, then come and clean all the surface areas.
Thank you very much, Doctor.
I think even the social club, I think they have the fumigators. So the ambulance which we use, the vehicle we use to transfer these emergency patients, we have kept a fumigator. So once we transfer the patients, we come and fumigate the whole ambulance.
Okay. Thank you very much, Doctor.
I will add something to on that. Like it's the solution what you have to use the 0.5 hypochlorite. So the what's available in commercially, you have to read out what's contained inside. I mean, especially you have so many brands when you go for the shopping. So you have to read out what's really contained inside. It should be, I mean, the surface cleaning we are using in the hospital level and the office level, you can use a 0.5 hypochlorite, but make sure if it's the high strength. Some people have a tendency to use for cleaning of the laptop screens and the desktop screens as well. It will damage in certain extent. I want to tell you, because even it's happened in our hospital as well. So I mean, better not to use for the screens. I mean, the laptop and the desktop screens.
Thank you very much, Doctor. Any other questions?
I think we have answered all the questions,
yes.
so not left anything to be asked.
Yes.
Maybe.
Okay, Kalum Priyanka, there is. Ishara, can you switch on the microphone?
Hello.
Yeah, we can hear you. Yeah.
Okay. My question regarding the face mask actually. Now, for example, if you are buying from the supermarket, it mentioned about the disposable 3-ply mask. According to this presentation, what I understood that it's mentioned surgical mask, and there are some categories mentioned. But how we can identify whether we are buying the correct mask or not?
Okay, actually, this what you are talking 3-layer mask. The principle of mask is the 3-layer outside is the water resistant and the middle filter, and the inside the water absorbent. Now, what the commercially available surgical mask, this is the 3-layer mask. But your question is how to assess the quality. It is actually coming under the consumer authority. But these are the, shall I share that slide? That
yes, sure.
Yeah, there are some charts. You can see the efficacy and all. And this is what we are in the Lulu and all our supermarket available is surgical mask. It's come from China. There 3 micron is the bacteria filtration efficacy, and 0.0 is the particle filtration. And there are USA and the Europe standard, and we have to go by this standard. So this manufacturer, they should mention, and before they market, I don't know how extent they are doing this one. Actually, I also have no idea, but anybody can answer.
Actually, Doctor, actually it is not mentioned. I have the box with me now. It's mentioned face mask, disposable 3-ply mask.
Yeah, that is.
That's why I raised this question: how we can be specific with the standard?
Yeah, this is actually I think our government approving this by checking this all this efficacy. And surgical mask 3-layer, it is same. All this category will be applied.
Okay, Doctor.
If I can add to that, usually all these are quality controlled by Ministry of Health and the Consumer Authority. They come, they do frequent checks. So you would have seen time to time even hand sanitizers the notices comes that they have banned from Oman, or they have removed because the standards of alcohol percentage is wrong, or they have used methyl alcohol instead of ethyl alcohol. So those issues are there. But generally speaking, I think whatever the mask is available in the markets are safe to use. But the issue is more than the brand. Even we have seen people use N95, the expensive one, more than 3 riyal, but they don't use it properly. Either the chin part is exposed, or it doesn't fit them properly, or they put it below the nose. So that is why even when in a desperate situation, even you can make masks from the kitchen towels you are using, the paper towel I mean. The only issue is it will not have the water resistantly outside, but even that might be helpful for if you don't have anything. That's why WHO came up even with cloth mask. It's okay because there was a demand for mask, unavailability, those issues. So generally speaking, to make things simple, whatever the things the masks available in the markets are safe, and quality is being checked by the Ministry of Health plus the Consumer Authority. But the most important thing is whatever the mask, even the cloth mask, if that is the only thing available, to use it properly, whether to fit it, to cover the nose, and not to have the leaks. I don't know. Is it clear or?
Yes, doctor.
But to add upon is ideally the one is the N95. When you see the protection wise, rather than this simple surgical mask and this cloth mask and everything, the most protection is N95.
So, any other questions? It seems no other questions from what we'll do. So, shall we wrap up the session today? So,
excellent. Good
yeah,
idea.
yeah. Thank you very much, panel of the doctors, Dr. Faisal and Dr. Anesta, Dr. Nusra Begum, Dr. Dinesh, Dr. Imthiyas, and Dr. Riyaz Mohammed. So you did a very valuable session today. As well, we got a lot of knowledge on that, how to prevent coronavirus. And in reality, there are a number of Sri Lankans, also country surveyors also affected. This is very timely, important topic. That's why we decided to do this. And you have added a good value for today's sessions. Thank you very much again. And I thank Roy to organizing this session with doctors, and also you are helping into Sri Lankan Social Committee Club also for in different ways and to monitoring the Sri Lankan patients. Thank you very much for all. So we'll wrap up the session today.
Yeah. I would also like to thank the Quantity Survey Fraternity as well as Mr. Roy from Social Club and all our doctors. I think you see only 6 of us here, but we are about 35 doctors in the team. They all are dedicated and helping us to monitor all our Sri Lankan patients here. And Social Club is giving us a very good support, as well as we have a support from the embassy as well. So thank you all, and have a pleasant day.
Thank you very much, Doctor. Thank you very much for all of you and attendees. Thank you very much. So be safe at home and protect as well as much as possible until we pass this difficult time. Thank you very much. Good night.
Thank you very much. Thanks.
Very much.